It's when two or more health and social care professionals learn with, from and about each other to improve interprofessional collaboration and quality of health care. Patients themselves enjoy being cared for by an interprofessional team. Staff enjoy the ability to work effectively with other people, and it seems from the research that certainly patients suffer less risk incidents and their health outcomes may well be improved by that. So it's a win-win for everyone. At Otago, we've really embraced this, and a few years back the Division of Health Sciences said that they wanted to have all of our health and social care professionals having at least 3 opportunities for interprofessional education throughout their different training programs. So students in Dunedin will come across professional ethics, interprofessional education, or collaborative action for long-term condition management, both classroom-based activities. They'll also come across simulation activities around dementia care, heart failure care. In Balclutha, they'll come across a interprofessional education involving people with multi-morbidity and seeing them in their homes. In Christchurch, they'll see an interprofessional learning activity around discharge planning or transitions of care. In Wellington, all of our students go through the Involve program, which is seeing people in their home with multi-morbidity in little groups. Palmerston North is a very interesting interprofessional education learning activity around cancer and life-limiting illness. In Tairāwhiti and West Coast, we offer 5-week rural immersion placements where the students live together in shared accommodation, which is a real highlight, as well as having their clinical placements have shadowing placements where they spend a half a day being with a student of another discipline and learning what they do. We often think that we work well in teams, but in fact we're not doing it very well. We're creating spaces where students can safely practice working as a team. And that means that they get to experience a little bit of conflict and difference, and they learn how to talk to each other, how to communicate effectively.
By learning together, they will be able to work together. If you study in silos and then suddenly on the work floor you have to work collaboratively, you have no idea what other people can contribute to the patient care. If you start learning that during your education, that will definitely have benefit. You know, once you're out in the field and actually deal with real patients. Suddenly their eyes open and they understand what a dietitian does or a physiotherapist does. They know what they can expect from them. They can even take their head on sometimes and ask the questions that would normally be asked by a physiotherapist.
Students would be able to carry over the skills that they will learn through this program, especially in terms of communication and collaboration. They could eventually trickle this into their respective careers once they graduate, with the ultimate beneficiary being the patients that they serve or that they care for.
What we see is those students working together, they can bring through their work what they've learnt from the different disciplines within their team, and they can bring that into their practice, and I think that's what the staff see. They can see the students working collaboratively, and we can learn from the students as well during the process.
They arrive not really sure about what this is all about, and it is really clear by the end of the presentations that they totally understand what it is to be working as part of an interprofessional team, to be interacting and to be talking to a real patient with real problems on a real patient journey. It is so wonderful to see the students using the Te Whare Tapawhā model. The presentations are so heartwarming, and for them it's like, gosh, this really works.
Interesting and challenging experience to begin with. Coming into it not knowing anyone else, they're all fresh faces from different disciplines. But once you get to know everyone, it made it a lot more easier to talk to everyone else and then see how we can all work together to work on this case that we were working on. Learning a lot more information about everyone else was the best part from it. The ability to work as a team amongst all the health professionals and how that they all come together and bring their own unique abilities, and how we can use those and the knowledge that they have to come to a plan and a goal for our patients.
I think it's really important that we all come in with quite an open mind and just to kind of learn while you're there and ask questions, and don't be afraid to sort of be wrong or make mistakes, and learn from each of the different people that are here.
I think when you asked what was good about it, is it's about people on so many levels in the work that you do. I've never had an opportunity to go live with 15 other healthcare students and share stories and build and grow, and that was fantastic. But also the people of the community as well were really engaging, very welcoming of the students to the community, and that's what I really loved, yeah. It just really allowed me to have some empathy for my colleagues and really understand what each role entails, and not thinking that being a midwife is the centre of the world. Apparently it isn't. You think in your role, I prioritise the people the most, you know, that's what I've been taught to do, but then you speak to everyone and you're like, oh, I'm not special at all, we all just want the same thing, we just have different approaches on what that means for that person.
Coming up to Gisborne where there is a higher health need in a rural community was amazing. Working with the other health professionals broadened that and how we can all work together to achieve a common goal, and that's like using the different strategies from other healthcare professionals, the other skills they bring, because at the end of the day we want the best for that patient. You make some amazing friendships, you meet some amazing people, and you get a different kind of perspective on healthcare at the same time. Like, I still talk to some of those health professionals, which is amazing.
Just a greater understanding of Māori health and rural health was pretty cool, but it was comforting coming back knowing some of my co-workers and also some of the people that come into the pharmacy I recognise, and then also get to observe many other healthcare professionals, which I think is crucial to understanding your own job later when you're a healthcare professional.
You read in literature and they tell you in your lectures about the health disparities amongst rural populations and Māori and quintile 5 areas, but when you actually go and you are living amongst it and working in that environment, you can see it, it's stark. I was on the program with another nurse in my class, 2 pharmacists and a trainee intern doctor, getting to know their role a bit more in depth, and they're still good friends of mine today actually, and so we keep in touch, and sometimes when I have a clinical question, feel comfortable to ask them.
I really enjoyed getting to work with other disciplines and getting to discuss kind of our roles in patient care, and actually really seeing the scope of how we can overlap and interact and benefit that overall patient in the end.
You know, as single healthcare professionals, we're not going to cover every base, and we're not expected to. That's why we work in a team together. And kind of having that freedom of communication to actually want input from other people instead of, you know, sticking to a really rigid hierarchy. And a lot of the professions that we're working with are also in their final years, as opposed to previous times when we've been a bit younger. We actually have a stronger grasp of what we do in our roles as health professionals, and it's kind of more realistic and kind of applying what we do know and how we actually would manage the patient in, you know, a few months' time.
I finished the IPE course 2 years ago, and then returned here to work at the start of last year. So I think what made me want to come back to the coast was partly the fond experience that I'd had here on the IPE program. I don't think I would have considered coming here if I hadn't have had that experience here initially. And a lot of it too is the people, I think. It's such an awesome community, and it's quite special to be a part of that. Some of the major challenges is considering what are their circumstances? Do they have electricity? Do they have a freezer to hold meals? Where do they live? How far do they have to travel to even come to an appointment? You know, are they travelling 2.5 hours up the coast to come and see me?
Last year I came on the IPE program, and I've now returned to work here full time as a physiotherapist in the hospital. You'll find there's a lot of people in caravans or in garages and some places that don't have running water and things like that, so it's important to cover all your bases really a bit more so than you would in an urban setting. Because you're sort of living with a group of like-minded people, you become quite good friends really, and it's quite a good support network, and learning about all of everyone else's different disciplines in that environment is quite beneficial, I think. I also enjoyed going out to some of the day trips that we did. I think just seeing that need for healthcare workers over here whilst being a student in the IPE program has sort of pushed me to coming over here and working here as a new graduate.
I drive past the student flats where they're living and I wish I could do it again.
Just do it.
Do it. I think it's a great program.
It's too good of an opportunity to pass up.